Acetylcholine is a substance in the brain that is involved in cognition, which includes memory, reasoning, communication, understanding, and overall function. Cholinesterase is another substance in the brain which breaks down acetylcholine. When acetylcholine is broken down by cholinesterase, the lack of acetylcholine doesn't allow the brain to store or retrieve memory the way it normally would. The Exelon patch provides patients with rivastigmine, which is a type of medication called a cholinesterase inhibitor. This means that when rivastigmine travels in the bloodstream to the brain, it attempts to block the effects of cholinesterase on acetylcholine. The Exelon patch rivastigmine transdermal system is indicated for the treatment of mild, moderate, and severe Alzheimer's dementia and mild to moderate dementia associated with Parkinson's disease. It uses transdermal or patch technology to provide rivastigmine, which means it releases the medication through the skin and into the bloodstream continuously for 24 hours. In a 24-week study, the 9.5 milligram per 24-hour dose of Exelon patch has demonstrated efficacy in patients' overall function, activities of daily living, and cognition, memory, in patients with mild to moderate Alzheimer's dementia. The 13.3 milligram per 24-hour dose of Exelon patch has demonstrated efficacy in overall function, activity of daily living, and cognition, memory, in mild, moderate, and severe Alzheimer's dementia. The Exelon patch does not change the course of Alzheimer's disease. The patch is visible on the skin, and the date of application may be written on it as a reminder. Exelon patch reduces the number of pills your loved one has to take each day and provides another option if he or she has trouble swallowing pills.
Indications. Exelon patch, rivastigmine transdermal system, is a prescription medicine used to treat mild, moderate, and severe memory problems, dementia, associated with Alzheimer's disease. Exelon patch is also used to treat people with mild to moderate memory problems, dementia, associated with Parkinson's disease. Important safety information. Exelon patch should not be used if the patient is allergic to any component in Exelon patch, including the active ingredient rivastigmine. Exelon patch should also not be used if the patient has had a skin reaction that spread beyond the patch size, had blisters, increased skin redness or swelling, or did not get better within 48 hours after removal of the Exelon patch. Mistakes in using Exelon patch have resulted in serious side effects. Some cases have required hospitalization and rarely have led to death. Most mistakes have involved not removing the old patch when putting on a new one and the use of multiple patches at one time. Only one Exelon patch should be worn at a time. If you accidentally apply more than one Exelon patch, remove all of them and inform the doctor immediately. Exelon patch can also cause serious stomach side effects, including nausea, vomiting, diarrhea, dehydration, decreased appetite, weight loss, and bleeding in your stomach, ulcers. Dehydration may result from prolonged vomiting or diarrhea and can be associated with serious outcomes. Some people have had a serious skin reaction called allergic contact dermatitis, ACD, when using Exelon patch. Stop using Exelon patch and call your healthcare provider right away if you experience reactions that spread beyond the patch size, are intense in nature, and do not improve within 48 hours after the patch is removed. Symptoms of ACD may be intense and include itching, redness, swelling, warmth or tenderness of the skin, or peeling or blistering of the skin, which may ooze, drain, or crust over. The incidence and severity of these reactions are dose-related. For this reason, treatment should be initiated with Exelon patch at a dose of 4.6 milligrams per 24 hours and titrated to a dose of 9.5 milligrams per 24 hours and then 13.3 milligrams per 24 hours, if appropriate. If you have not taken Exelon patch for more than 3 days, do not start taking it again until you have talked with a doctor. The most common side effects of Exelon patch include depression, headache, anxiety, dizziness, stomach pain, urinary tract infections, muscle weakness, tiredness, and trouble sleeping. Weight should be checked while the person is using Exelon patch. Weight loss, loss of appetite may occur. People below 50 kilograms, 110 pounds, may experience more side effects and may have to stop using Exelon patch due to these side effects. People at risk for stomach ulcers or who take certain medicines should tell their doctor before starting Exelon patch, because serious stomach problems, such as bleeding, may occur. Exelon patch may cause fainting or slow heart rate. People with certain heart conditions should tell their doctor before starting therapy. People with serious lung conditions and difficulty breathing, bladder problems, or seizures should consult their doctor before using Exelon patch. Extrapyramidal symptoms, e.g., uncontrollable facial or body movements, including tremor and restlessness, could occur or get worse. Parkinsonian symptoms, particularly tremor, have worsened in Parkinson's disease dementia patients treated with Exelon, rivastigmine tartrate capsules. Before using Exelon patch, people should also tell their doctor about any medical conditions they have, including if they have had a loss of appetite or are losing weight, or if they have had a skin reaction to rivastigmine, the medicine in Exelon patch, in the past. People on Exelon patch who feel dizzy or drowsy should not drive or use machines. Tell the doctor about all other prescription or non-prescription medicines the patient is taking. Exelon patch should not be taken at the same time with other medicines that have a similar effect on the body and the brain, cholinomimetic agents, or with anticholinergic medicines. Inform the doctor if the patient needs surgery requiring anesthesia while using Exelon patch.
Be sure to review the full prescribing information for Exelon patch included in this DVD. In the next chapter, we'll discuss how to apply the Exelon patch and things you need to know about helping your loved one during this treatment.